My name is Erin Bryant, and this is my final project, Public Health Nursing, also about public health. What is public health? Public health is defined as a state of complete physical, mental, and social well-being, and not merely the absence of infirmity. Therefore, public health is regarding the health instead of the individual. CDC defines public health as the science of protecting and improving the health of people and their communities. Combining both definitions, public health is the science of protecting and improving the complete mental and physical well-being of communities. What is health promotion? Health promotion is the process of enabling people to improve their health by increasing control over the detriment of health. Related to public health, health promotion is the main goal of any career within the public health field. Establishing hygiene rules and educating people on diseases and bacteria all stem from the want to promote health. Health education is a combination of planned learning experiences based upon proven research theories and models that provide individuals, groups, and communities the needed skills, knowledge, and opportunities to make informed and meaningful health decisions. What is health prevention? It's the process of enabling people to improve their health by increasing control over the detriments of health. There are 4 types of prevention. There's primordial, primary, secondary, and tertiary. First, health education responsibility. It is to assess needs, assets, and capability for health education. For the career that I chose, which is public health nursing, the nurse will assess the healthcare needs for a community, as in checking for data regarding the gender, ethnicity, the race of people. They will assess the situation, also using the nursing process, along with the 7 responsibilities. The second health education responsibility is to plan health education. That's when you come up with a plan in order to tackle the problem within the community. Public health nurse will start to outline a plan to fix any problem that he or she identifies within the community, therefore diagnosing the problem with the nursing process and plan a solution around to correct the problem. The third health education responsibility is to implement health education. This means being able to put the plan into action, which is also what the public health nurse would do. Fourth health education responsibility is to conduct evaluation and research related to health education. This means to interpret if the plan was effective or not by using research to back up the effectiveness. The public health nurse will then evaluate the plan and try to replan if the plan was not effective, or repeat the program if it was successful. The fifth health responsibility is to administer and manage health education. This is basically using the responsibility to be able to maintain the plan in order to keep the plan working. After evaluation, if the program was effective, then the public nurse would need to make sure that the program continues to work to get better. The sixth health education responsibility is to serve as a health education resource person, meaning that the public health career person should be able to provide information to the public upon request. Part of being a public health nurse is to provide education to the public. Also, if a person has concern about the community's health, he or she will approach the health nurse for information. The seventh responsibility of education responsibility is to communicate and advocate for health and health education, meaning to be able to stand up for information for the public about health. The public health nurse is already taught to advocate for their patients, so this will be for when the nurse is able to communicate to a group of people about health and advocate for the greater good of the community. The health organization that I chose is Nurses with Purpose. Their mission is to enrich the lives of others as we enrich the lives of ourselves. They deal with global health. Their primary focus is in South Africa. However, they are beginning to focus their efforts in Guatemala. The website is at nurseswithpurpose.com. They also have a YouTube link. They have tabs for the home, which describes what they're about, has their mission on it, and gives information about what the organization is. They have mission trips tab, which goes more into the types of details that they do on missions. They have an apply button. They have a sponsorship and teams, and they have a donate button so everyone could donate to this nonprofit organization. And it has an action button, which basically just shows what they do. The creation of the Nurses with Purpose was founded by an RN. Her name was Elaine Alston while she was still in nursing school. She had a grandmother who was a nurse in South Africa who she did not know. However, she was also born in South Africa but moved to the U.S. when she was about 5, and when she got older, she wanted to expand her medical care beyond the U.S., related back to her roots. The organization interests me is because it's centered in South Africa, and I would love to go to Africa one day in any part and help with the medical care over there. It's a nonprofit organization, meaning that nobody benefits who works there, such as getting a check or anything. And they help to come up with solutions to health concerns in their focus areas, and they help those in need, which are more the reasons why I would love to be a nurse. My interest in public health. My biggest interest is education. Education and awareness is very important. It helps solve problems and increase health ignorance, such as being afraid, having stigma behind going to the doctor. We focus on the betterment of the community and individual people. Other interest in public health is also program developing. Being able to educate people on diseases and disorders is something that I would like to do, and one way to educate people is to develop programs, which is what this class has taught me on how to do. My major is a Bachelor of Science degree for the nursing BSN. The field allows me to educate people on health practices and increase the knowledge of everyday person, help heal people, and leave a lasting mark on people who I treat. Career in public health that I would choose is a public health nurse. They do the responsibilities of a registered nurse, however, they're more involved within the community, and they focus on tackling problems within that community. Career goals within this would be to work overseas with countries that need medical assistance, work in rural areas such as Mississippi that do not have a lot of medical assistance, working in rehab facilities, developing health programs that decrease the amount of secondary diseases such as hypertension, obesity, or diabetes, and work with sexual health for both men and women to decrease the problems that Mississippi has related to sexual health. And here are my references.